Welcome to a special episode of Unmasked, the CCI Anesthesia podcast. I'm Marguerite Garner, and today I'm honored to step in as a guest host for a conversation that goes beyond clinical practice and into identity, experience, voice, and leadership. Being a woman in anesthesia comes with unique challenges and unique strengths. And today, we're going to talk openly and honestly about both. Whether you're a woman in medicine or someone who wants to better understand how to support gender equity in healthcare, this is a space for real stories, real perspectives, and real connection. Welcome to Unmasked, the CCI Anesthesia podcast, the show where we dive deep into the world of anesthesia practice improvement, quality enhancement, and the evolving landscape of healthcare. I'm Marguerite Garner. Thanks for listening as we explore the strategies, innovations, and stories that shape the future of anesthesia care. Get ready to be enlightened, inspired, and most importantly, unmasked as we unravel the many layers of the current state of anesthesia. This is Unmasked. I'm joined by two incredible clinicians and leaders who bring wisdom, resilience, and authenticity to this discussion. We're pleased to welcome Sarah Finch, CRNA and Regional Clinical Officer for CCI Anesthesia's Northern Midwest region. Sarah oversees operations in Michigan and Ohio and also serves as Chief CRNA in Three Rivers, Michigan. With her expertise in anesthesia and non-surgical pain management and her passion for mentoring clinicians, supporting wellness, and building strong clinical teams, Sarah brings a thoughtful and grounded leadership perspective to the panel. Thank you for joining us, Sarah.
Thank you for having me.
We're also joined by Andrea Bouchard, Chief CRNA at Northern Maine Medical Center, where she has led independent anesthesia practice since 2017. Andrea began in high acuity critical care and level 1 trauma anesthesia at Maine Medical Center, but ultimately chose to return home to provide advanced, evidence-based anesthesia in a rural setting. Andrea is a passionate advocate for elevating perioperative outcomes in small hospitals and ensuring rural patients receive the same standard of care found in major medical centers. And beyond her clinical leadership, she's a dedicated mother of 2 young boys and a clinician deeply committed to patient-centered care. Andrea, we're thrilled to have you with us.
Thank you for having me.
So I'm going to start with a question to both of you. Why did you choose to transition from nursing into anesthesia? We'll start with Sarah.
I think that I originally had a completely different plan in place for my life, but as we all know, plans go by the wayside. So I went into nursing with a medical focus to go into be a physician. And when I was working open heart ICU, I discovered the anesthesia track and CRNAs and fell in love with their passion on autonomy and the way they can practice to the full scope of their ability. And that's what changed my mind.
And Andrea?
Well, I had a somewhat similar track. I was working as a nurse in a cardiothoracic intensive care unit. I was considering going to do something further with my career. And the 2 tracks I was actually considering was a cardiothoracic PA or anesthesia. I knew the cardiothoracic PAs very intimately from working with them in the anesthesia side. In the nursing side before going into anesthesia. And then on the other side, I saw the anesthesiologists and CRNAs that were bringing the patients to us. And so I got to see kind of both entities. And when I really researched both, I realized that for me personally, having a work-life balance to be able to, at the time in the future, start a family seemed like anesthesia would be a good avenue. And I'm glad that I gave that a chance to explore, because as soon as I got into it, I realized that the intensive level of care that we provide as anesthesia providers really was the avenue that I felt the most passionate for.
Okay. And Andrea, what was something that you believed about your career early on that actually turned out to be different and was actually true?
I would say that one of the biggest things is that for anesthesia, there's just so many avenues. It's not as specific to one domain. Like, the beauty of our careers is that you can specialize in any entity that you really want to. There's practices across the country that you can specialize in whatever area or avenue you want to be pursuing. And so you can do everything from straight OB practices, pain medicine. You can work at large tertiary centers. You can work in rural centers and be completely autonomous and independent. You could do straightly pediatrics. The beauty of anesthesia is that you have any specialty that can be exposed to anesthesia at some point in their lives. And so you can really hone in on what you love, what you're passionate about, and really kind of foster a career in that area specifically.
And Sarah, did you have female role models in your profession very early on, or did you find that you had to become that role model for yourself?
Honestly, I was really blessed in the program I went to. The majority of our faculty, both clinical as well as didactic, were females. The director of our program is a female. Our student coordinator was a female. But as far as the actual every day teaching us what we need to know, making sure that we had that solid educational background before we went in and clinically took care of patients, were all females. So that was very beneficial to me to know that being a leader in anesthesia as a female was something very, very practical.
And Andrea, what did the transition from a student to a CRNA look like for you?
So I was really blessed. I had wonderful mentors at Maine Medical Center that had essentially worked with me throughout my entire training to help facilitate my learning, and then as well grow me into a new grad CRNA. So the transition initially was quite smooth, particularly at Maine Medical Center. I think there was a little bit more of a transition moving to rural independent practice. And at that point, I actually had been recruited by a previous preceptor as well when I was a student. And so I moved home to work with him. And that transition was a little bit less seamless. I would say there was an adjustment. I remember walking from this large tertiary center that was, state of the art, and walking into this tiny little rural hospital that had been built in the 1940s. And I remember them asking me, what do you think this switch is? And I had no idea. And it was a light switch. It was that old. And so that transition was a little bit different. And since then, they've remodeled the whole place. But transitioning from more a new grad into independent practice, I think was probably the bigger transition of recognizing that you are that sole provider, that there isn't anyone else to come in those urgent situations, and that you just have to fall back to your clinical and academic training to be able to manage those situations.
Okay, so it's interesting because one of the next questions has to do with the amount of CRNAs that are women. And so while you came from an environment and a situation where you were surrounded in preceptors and in CRNA school with individuals that were females, what we find is that research shows that nearly 60% of CRNAs are women. So it's not 80, it's not 90, it's, a little more than half. Andrea, what do you think leads so many women down the path of being a CRNA or making a transition?
Women have a passion for improvement oftentimes, and I think that they look and strive to better their environments. And so I think that's akin to the world of any type of medicine, but also anesthesia practices. I think that, as a nurse, someone who's looking to have a good work-life balance, good career, I think anesthesia naturally kind of provides that opportunity for them. So I can see it for both a work-life balance, and I can also see it from a career-driven standpoint of having the drive to go back to school, commit themselves to a new career, commit themselves to an ongoing lifelong learning experience. So I think women are naturally innate giving to want to do more to better themselves. So,
Sarah, have you ever had a moment where you felt you had to prove yourself more because you were a woman?
Absolutely. Yeah. Like I said, I went into a practice where it was all male providers. I do tend to feel like, depending on practice as far as hours, what's required of you, sometimes I feel like women have a innate want to be with family, to be present for children, those types of things. So I do sometimes feel like some CRNAs are in practices where they have the ability to work that 7 to 3, maybe not take call, maybe not do weekends, even though positions allow us to work for full scope, to take call, to be independent, whatever the case may be. So I do think sometimes in smaller independent practices where you are required to take more call, work more weekends, there is sometimes not as much of a female presence as I would love to see. I do think that is changing. My current practice is 50-50 male and female, which is awesome. But there were definite times as I moved through my career where sometimes I felt like my voice was not heard as much. And then you have to step up and make your voice be heard, which sometimes can be taken as you being aggressive or difficult or whatever the case may be, where your male counterpart may stick up for themselves or their practice in the same fashion or in the same manner and not be portrayed as being aggressive or difficult. And there is definitely a finesse that I had to figure out on how to make myself present and be taken seriously without coming across in that manner.
How did you navigate the male-dominated environment of an operating room?
I think a lot of it is how you hold yourself and how you visualize yourself. I go into my OR every day knowing that I am in control. I am going to take the best care of my patient that I possibly can. And if I see something that is not appropriate, not the way it should be, whatever the case may be, I have zero problem stepping up and advocating for that patient. And I think if you walk into the room with an air of confidence, knowing that you are fully well trained and capable of taking care of that patient and running whatever situation comes at you, other people in the room naturally gravitate to the fact that you have that confidence.
And Andrea, what differences in your experience have you observed in communication dynamics when you're working with male versus female peers or surgeons?
Yeah, absolutely. I think one of the caveats that's always used is that women are more emotional. And that's somewhat of an accusation that's almost used against us at times when we tend to bring a topic forward or an attempt to advocate. It's not that we're emotional, we're just all passionate. And yes, there is an emotional tone to women that is innate in us, but our passion is misconstrued for emotional and or miscategorized in that nature. And that sometimes is used as a tool to discredit whatever the topic is that's being brought forward. So scripting the way that you bring forward concerns, bringing it, like you said, developing a finesse, which is more data-driven, bottom lines up front, more direct, less removing anything that would be perceived as feelings, to have a conversation that is understood in the same dynamic. I think that sometimes women are more passionate. And so I think that that's just sometimes a misunderstanding from the context of what's being delivered.
Okay. And I mean, it sounds like for you, both of you actually, that those differences definitely have shifted how you approach, how you collaborate with individuals.
Absolutely.
So when you walk into a room, do you kind of assess the situation and go, I know this person is doing this and this is how their mood is, and I'm going to approach the conversation like that. So it's social cues and emotional cues and just personal cues from experience.
Oh, yeah. There's a lot to it.
There's a difference from when you're speaking with administration than when you're speaking with surgeon than when you're speaking with a colleague and clinician. And I think navigating those conversations and scripting yourself in a way that meets the needs of the conversation is key. But I do think that there are some different challenges that are unique to those kind of more complex, higher level conversations when you are a female, no question.
Yeah, I think you have to take into consideration the perspective of your audience and how you might be perceived. And you shouldn't necessarily have to change who you are or what your values are, but you might have to present it in a way that the person you're speaking to is going to perceive it and receive it well. Right. And so I think there does become a level of finesse and understanding and growth throughout your career. From being a baby CRNA to being an experienced leader, I've changed how I handle things drastically differently. And it just comes with time and experience.
Yeah, I think in leadership in general, you kind of recognize that the person that's receiving the information is the one that you actually have to cater to, and not necessarily what you want to say. It's how they're going to receive that information.
Exactly.
I would agree with that. Even just knowing what they're looking for. Some people are more data driven. Some people want the absolute numbers straight out the gate in that conversation. Other people understand your experience and they want to know what you've done in your perspective. And so catering those conversations just like that to that point is understanding who the audience is and making sure that you're directing your tone and the way that you're carrying the information to them in a way that they're going to receive it.
Yeah. So the next question is, I want to say it's funny because I hate the word because I think there's this tone with it, but I fully appreciate the question. And I think it's an important question. So have you struggled with imposter syndrome?
Oh, absolutely. I'm sitting on a podcast right now as a leader within an anesthesia company going, what is happening right now? Let's just call it what it is. Like you start as a baby CRNA and you grow and you learn. And then I've gotten into CCI anesthesia and I have helped open several places and I've been a leader within several places. And now I'm growing within leadership within the company. And this was never somewhere where I saw myself as far as my career was going. And I'm super grateful and I love it. And I have truly found a passion in leadership and helping other CRNAs grow within their practice, grow within their strength and their confidence. And I do think that it's been a big change over time.
How do you build and maintain your clinical confidence?
I think you have to continue to challenge yourself. You have to continue to grow. You have to continue to read and learn. And I went back to school for pain management 11, 12 years into my career. Did I ever think I would go back to school? No. Right. But I knew that there was a knowledge deficit. I knew there was something that I could gain knowledge for to increase my practice, the ability to service my patients. And I think that it's important that you continually grow and change. And you listen to other people. You know, your colleagues have a lot of knowledge and there are ways that they would handle a case or an anesthetic or a complicated patient completely different than I would. And I think having those conversations and trying new things helps continue to grow your confidence as well as your clinical skill spectrum.
Okay. And Andrea, have you struggled with imposter syndrome?
Of course, certainly. I think, like you said, just being here in this instance, being asked to speak about women in leadership is really one of those honors that you just never perceive yourself being asked to do. So yeah, I think CCI just has such an innate way to highlight its clinicians and leaders. So I'm been appreciative to even be sitting here with you guys.
Yeah.
So, we're kind of going and back and forth between clinical and your leadership experience and, how you're navigating this as a person as well as a clinician. And in a clinical environment for you, Andrea, how do you advocate for yourself in a room where you may be the only woman or one of very few women?
Yeah, so that's been the majority of my career as a rural provider. And one of the challenges that, I've encountered in the past with, strong personalities, sometimes louder voices are not always the voices that need to be heard. And so navigating that calmly is one of the biggest things, because I think if you meet people that are at a certain level with the same energy, it tends to escalate. And so in some of those situations where I have been the female voice to speak with someone who's being boisterous and been one of the females to do that, I think, navigating those conversations in the moment by calming the situation, de-escalating, and then articulating clearly, calmly, emotionless, and focusing on the patient, the needs of the patient, and articulating that forward versus the emotion or opinions. Using facts as foundation instead of opinions is a key component to that. And so that's traditionally my go-to for being able to navigate those conversations, but then holding true and having the confidence to know that you're doing what's best for your patient and advocating in that moment for that patient. And that's what matters most.
I also think, based on what you said, being consistently clinically strong and coming with those facts versus feelings, and it gains a confidence, everybody else gains a confidence in you, that I'm not disagreeing with you because I'm trying to upset you. I'm disagreeing with you because of XYZ. And I think that you earn that level of respect and confidence over time with consistently bringing strong clinical evidence on why you're making the decisions that you're making. Because I think sometimes as women, we have to have more of that clinical based knowledge and skill and reasoning for what we're doing versus I'm not doing that. Correct. And I think consistency in that also builds confidence in you from others.
And credibility for women practitioners.
Yes, exactly.
We see that a lot where one person's statement isn't necessarily equated when it comes from a different mouth. Falling to those baseline factors, using data, clinical evidence-driven best practices to present what's necessary tends to be our fall to, because it helps to speak for us. It speaks its own necessity.
we're talking about all of the experience you guys have with leadership and working clinically, independently. And I know, Sarah, you had mentioned that you had mentors through this process that helps you grow professionally. What about those mentors specifically for you stuck out?
I think feeling supported. I think sometimes starting to build that confidence in yourself comes with one little baby step. Their support of, hey, you're making the right decision. Having that just like, you got this, a little bit of an encouragement. And I think that's really important when you're mentoring new CRNAs, whether they be male or female, encouraging people, giving them confidence in what they're doing, empowering them to make decisions, talking through things with other people, and collaborating on things just helps further you and advance you.
Okay. And Andrea, have you had any mentors that played a role in your career that maybe helped open doors for new opportunities? Like both of you were here at a podcast and in a leadership position, right? So did you have someone that you looked up to from a leadership perspective that could help you, or from a clinical perspective that opened new opportunities?
Yeah, I mean, obviously the leadership that I've experienced with CCI would certainly be the foundation there. Bronson's been absolutely amazing for both a clinical and leadership position. He's helped us expand and become comfortable being the sole providers, where we were at least used to having another CRNA in the facility. Helped us kind of gain the perspective of what that would look like as we transitioned. He was there in a partnership with us. And then obviously in a leadership capacity, Bronson's been very helpful to support us in anything that we needed to have conversations with administration, adjusting our schedules and navigating removing call. All of those conversations came through CCI and navigated in partnership with them. So I would say from a clinical and leadership side, in the last several years, we've had a really close relationship, and that's really fostered to where I am today with him.
Okay. And Sarah, what would your recommendation be to any peers that are trying to find a mentor, or how should they go about seeking support with someone that could become a mentor?
As we were answering the previous question, I thought of something from someone actually within CCI that really helped push me forward as a leader. And it was, they put me in difficult situations. And they did that on purpose because they knew I could handle it, even if I wasn't sure I could handle it. Mm-hmm. And they gave me the framework to be able to make decisions and handle difficult conversations. And I think someone that isn't going to always just yes you need that support. You need that confidence boost. You need that person to be your cheerleader and in your corner, but you also need that person to challenge you so that way you can grow. And I think that someone specifically within leadership within CCI really did that for me, and that helped me grow significantly as a leader.
Andrea, as someone that's now in leadership, how do you ensure that women on your team feel seen and feel supported?
I think leveraging up any of your clinicians is a huge component. Finding out what they're passionate about and letting them go with it. So one example is I have a CRNA who has an interest in multimodal practices. And so kind of giving her the confidence to explore that, giving her the tools, the places to research and develop protocols to present to the team, bring to surgical services was one avenue. I think finding what each of your clinicians is passionate about and leveraging each of those key components is one of the best things you can do to elevate their own voices for them and give them the confidence as well.
Okay. And Sarah, how do you encourage female clinicians to bring their voice forward in those types of discussions?
I try to empower my clinicians to make decisions, use me as a sounding board. Go ahead and have your conversation after you've used me as a sounding board. Bring me in if necessary. And then I'm going to echo that so that shows that their decision up front is being echoed by the leader, mm-hmm. and that you guys are a unified front and they're making correct decisions. I always find that if you are in a complicated situation and you're maybe discussing a difficult case and should we do this case at this facility? Should we not do this case? That's often a difficult conversation to have. And if you allow your provider to have a conversation with you, you guys create a solid plan together, let them present it. That gives them confidence, but then also you can fully back them up if necessary, which then just reinforces that.
Okay. And do you find from your experience that women lead differently than men in anesthesia?
I would say yes. I think that depending on the clinician or the leader, I find that sometimes women are more empathetic. I do think that can actually empower you as a leader. It makes you more aware of the perspectives of the people around you. It makes me approach each provider a little bit differently. And usually every couple of months, I try to ask my providers, what am I doing well for you as a leader? What am I not doing well for you as a leader? What can I do to better support you as a provider within our team? And I try to, I don't know, one of my providers really likes lemons. So every once in a while I'll get a lemon candy or something just to
personalize it.
Exactly. Yeah. Personalize them. Make sure that they matter to you. Yeah. And I think that aspect of leadership really kind of fosters a culture of cohesiveness, team building. And I think when you feel like you're part of a team and you are being met with integrity and support, you naturally become a better member of the team and a better provider.
I can say that I absolutely agree with that, and I've experienced it. It's I think of an individual that I worked with, and the very first question that they asked me was, "What is your why?" Mm-hmm. Right? And then so I've had to figure out what my why was, and then that person also made a connection with every single person that they worked with. Yeah. They knew every janitor's name in the hospital. Mm-hmm. They knew where their kids went to school. Yeah. And so I find in my experience also that it's a similar sort of way. So it's nice that it rings true in multiple different avenues is what I'll say. So we're going to change this up a little bit, and we're going to talk about work and then your actual home life, your personal life and work-life balance. Andrea, how do you balance your identity as a clinician versus your identity outside of the OR as a mom, as a wife, as all of the things that you have to be every day?
I think at times those two can mesh, and I think at times they are distinctly separate. I think as a clinician, there are times where you know that you're the advocate in the situation that needs to be heard. And standing bold and firm and concrete based off facts and data and best practices is the way to lead some of those conversations. At home, that's a little bit of a different conversation. I believe in the context of marriage of being there for each other. And so there's times where you give away yourself or your thoughts of your own perception to support someone else in a different way. So I think, there's parallels and there's opposites to that, but at home certainly is a little bit more of a balance than maybe sometimes at work.
It's a different type of partnership.
Yes, yeah. Very different.
Okay, and Sarah, have you experienced that your professional goals have changed as your life has evolved?
I'm in a leadership role, which is somewhere that I never thought I would ever be. So I think that my goals now are focusing more on leadership. Obviously, I love my clinical responsibilities and I don't ever want to get away from that by any means. But I find that within CCI, we are empowered as leaders to be able to actually make a difference for providers, make a difference for patients, make a difference for relationships within companies, relationships within CCI and the facilities that we work together with to provide anesthesia care. And I think that there is a balance between that I never saw myself excelling in. And I'm actually really enjoying the kind of change a little bit.
If you're looking forward to the future, because as you say, things evolve over time, right? How you evaluate things in life change. If you're looking forward, what is a hope that you have for the next generation of women in anesthesia?
I hope that we don't have to have these conversations. I mean, that's
absolutely true.
Yeah, that it's a seamless thing, that it doesn't matter who you are or what your background is or what your gender is or any of those cases, that you're able to walk in and you're able to provide stellar anesthesia care. You keep people safe. You have good conversations. You lead with grace and integrity, and it doesn't really matter who you are. And that's what I hope to see for the future.
Andrea, do you see true momentum toward gender parity in leadership roles?
I think in different avenues, yes. I think one of the entities that is a little bit more challenging is sometimes these rural dynamics. And so CCI is equipping their clinicians and their leaders in a way to be able to be strong supported leaders within their facilities, but then also know that they have a wealth of support behind the scenes as well. And so I hope, like you said, that we reach a day where it is the same professional integrity and weight, regardless of the voice that it comes from. And I think that by having these conversations and recognizing the differences and elevating the characteristics in both entities that make us unique, that we can hopefully get to that someday.
So we're going to end with a question for both of you. Sarah, if you have a chance right now to talk to your younger self, the woman that was just graduating CRNA school, knowing what you know now, what's something that you would tell yourself?
Appreciate your growth. Because I feel like I was very perceived as one of those women that were aggressive and difficult because I had no problem advocating for my patient or situations that I felt were not right. And I didn't always do it the right way. So I was perceived negatively in some cases. And the growth I've made in that aspect from then to now, and how much that has changed and how my perception has changed, how I handle things have changed. I think I wish I would have appreciated that journey a little bit more and appreciated the growth that was to come.
And Andrea, what would you say to brand new baby CRNA Andrea?
Brand new. I would probably say leading with confidence, integrity, moral accountability right from the get-go. I think those qualities were always there, but I think without full awareness of it, you learn as you go. Who I am today, I am because of what I've learned along the way, just like you mentioned. But as a young leader, if I would have had a mentor like I did with CCI in the last 3 years, I think that the dynamic might have been different in that if someone would have brought some of these characteristics to the table ahead of time, I might have saved 3 years of learning along the way. So I think, but everything it's the grace of what we do as clinicians and as leaders, and we learn and adapt, and that's what makes us human. We're not perfect. Accepting those responsibilities and being accountable for change and fostering that growth within ourselves is what makes us who we are.
It's not necessarily about the destination,
Yeah,
right? It's about the journey to get there.
That's very valid.
So I want to thank both Sarah and Andrea so much for sharing so openly and honestly. Thank you to our listeners for joining us in this very important conversation. The voices of women in anesthesia, your voices specifically, are reshaping the profession every single day. And the profession is stronger because you're in it. So I'm Marguerite Garner, and this has been a special edition of Unmasked. From all of us at CCI Anesthesia, thank you for listening, and thank you for continuing to elevate the future of anesthesia. Unmasked is brought to you by CCI Anesthesia, leaders in anesthesia services for over 20 years. Subscribe to Unmasked, the CCI Anesthesia podcast today, so you never miss an episode. For more resources and information, visit the CCI Anesthesia website at ccianesthesia.com. We look forward to having you with us next time as we continue to unveil the remarkable stories and innovations shaping the future of anesthesia care. Until then, stay curious, stay informed, stay safe, and we'll see you next time.